Hey y'all, I'm Courtney Sharea. Welcome to my channel. Today I'm going to share with you 4 healthcare administration career options that not many people really talk about. I've been working in healthcare administration for the last 9 years. I started my career out managing a comprehensive breast center that specialized in the surgical removal of malignant and benign breast diseases. From there, I went on to be a business manager at an ambulatory surgery center, and then I went on to do revenue cycle management for a healthcare technology company where I specialize in revenue cycle management for large pathology groups. I currently work for one of the big 5 health insurance companies as a lead key account manager. My job title is not a good indicator of what I actually do on a day-to-day basis, but we'll talk about that in a later video. I also have a dual master's degree, one in business administration and one in health administration. Now that I've introduced myself to you, go ahead and introduce yourself to me by hitting that subscribe button, liking this video, and leaving me a note in the comments. Also, don't forget to hit the post notification so that you can be notified every time I upload a new video. My channel is about career, lifestyle, and beauty, so if you're not really interested in the lifestyle and beauty things that I will be talking about, just know that I will upload 2 videos each month in regards to healthcare administration, okay? To all of my returning subscribers, hey, how you doing? I'm doing good, thanks for asking. When discussing healthcare, we always hear about the clinical side of things, we always hear about doctors and nurses, but we never hear about everything that happens behind the scenes, like who's running these healthcare businesses. Considering the healthcare administration field is a rapidly growing field and is projected to grow by 30% within the next 10 years, people rarely talk about it. And when they do, they really only talk about medical billing and coding. I am here to share 4 healthcare administration career options that not many people talk about. The first career option is hospital administration and management. This career option is actually kind of popular, but I don't think it gets the shine that it deserves. I'm also going to bucket practice administration and practice management under this career option because they pretty much all do the same thing. It's just that practice managers are working in smaller medical practices while hospital administrators are working in hospitals, but they are all doing the same job function. Hospital administrators are responsible for the development and implementation of programs and policies that are related to the day-to-day business operations of their facilities. They are also responsible for managing teams, department budgets, as well as strategic planning. These roles are very demanding and require a lot. I remember when I was a practice manager, I would work anywhere from 50 to 70 hours per week, and I still felt like my job was never done. There was always something to do. Ongoing learning is imperative to keep up with. As you know, healthcare is mandated by the government, and they always be changing stuff. For our own good though, but staying abreast of all of the regulatory changes is a must. The minimum education requirements for these types of roles are typically a bachelor's in business, healthcare administration, or accounting. And for C-level positions, you may be required to get a master's in business administration or a master's in health administration. And side note, some CEOs of hospitals are required to be MDs as well. So just a side note, something to think about. A few job title examples would be a nursing home administrator, a CEO, CFO. You can also find jobs in hospital administration under quality assurance, legal, communication, and public health. There are a plethora of options. Salaries vary for this career option. Practice administrators working for small to medium-sized practices can expect a base salary of $50,000 to $70,000. On the other hand, hospital administrators can expect a salary of $120,000 up to $300,000. The next career option is health information technology and health information management. Yes, I bucketed these 2 together. Really, I could have separated them, but I put them together. Health information technology is the digital systems that collect and organize health information. Health information management incorporates the data that goes into those systems, but also analyzes and protects the data. Being able to utilize these digital systems to compile healthcare data is extremely important because healthcare data is utilized to make clinical and healthcare business decisions. Before I jump into the education requirements and the different types of jobs that you can get in the healthcare information management or healthcare information technology field, I want to talk quickly about electronic medical record software. Electronic medical record software is the perfect example of how health information management and health information technology collides. So you may be asking, what is electronic medical record software? Electronic medical record software, or EMR, is a software where a collection of a person's medical records are stored. Their demographic information, like their name, date of birth, address, and insurance information, are housed in this software. And their encounter notes from their visit with their doctor, like their diagnosis codes, their CPT codes, or current procedural technology codes, as well as all of their notes from their visit, are stored in this system as well. I think EMRs is the perfect example of showing how health information management and health information technology collides, because those professionals who work in healthcare information technology are typically the ones who are building and programming these EMR systems, and the health information management professionals are the ones who are pulling the data out of these EMR systems to do data analysis. The minimum education for this career option is typically a bachelor's in health informatics or computer science, and for some health information management roles, you may be required to get your RIA certificate. And RIA stands for Registered Health Information Administrator. The types of jobs that you could find in healthcare IT are jobs like EMR Integrations Manager, Implementation Manager, Product Manager, Hospital Network and Systems Engineer. And two examples of types of jobs that you can find as a health information manager would be a HIM director or a health information data analyst. The starting base salaries for both health information management and health IT are very similar. You can expect a starting base salary of about $65,000, and it can go up to $130,000 plus based on the position and experience. The third career option is revenue cycle management. Revenue cycle management is the process used by healthcare systems in the United States and all over the world to track their revenue from patients, from their initial appointment or encounter with the healthcare system to their final payment of balance. So basically, the revenue cycle management process starts whenever the patient makes their appointment to see their doctor, and it ends when the patient or the patient's insurance makes the final payment on the balance and the patient's balance is zero. Medical billing and coding is one of the most popular career fields under revenue cycle management. Revenue cycle management is actually a great way to get your foot in the door in the healthcare administration field. A lot of the jobs do not require any type of degree. However, if you're interested in becoming a certified professional coder, then of course you will have to get your certification. And if you are interested in management or director level positions, then you will need at least a bachelor's degree in management or healthcare administration. The different types of jobs that you can find in revenue cycle management are a director of revenue cycle management, a revenue cycle manager, or a coding manager. And the starting salary for these positions are somewhere around $50,000, and they can go up to $130,000 plus. And the final career option that I have for you is healthcare business consulting. Consultants are professional problem solvers. They need to have enough knowledge to identify opportunities for improvement, then create solid solutions to help their clients achieve their desired outcomes. You can become a healthcare business consultant in any of the career options that I share with you, plus more. The opportunities are endless. You can be a consultant that specializes in revenue cycle management. You can be a health information technology consultant. You can do consulting work in the legal and compliance space in healthcare. You can be a consultant that specializes in healthcare HR and operations. And again, the list goes on and on. The minimum education requirement to become a healthcare business consultant is typically a bachelor's degree in business or in the related field. Base salaries for healthcare business consultants typically start off around $80,000. A career in healthcare administration comes with a lot of responsibility and a lot of stress. However, it is extremely rewarding. My goal is to bring awareness to the healthcare administration field because it's lit. Healthcare administration professionals are literally out here making the business side of healthcare work. Next month, I plan on doing a video about entry-level positions in healthcare administration. So make sure that you are subscribed. Also, make sure to like this video, leave me a comment below because I talk back. I respond to every single comment and I really enjoy chatting with y'all. Also, make sure to share this video with someone who you know is interested in the healthcare administration field. If you haven't done so already, come and find me on Instagram. I'm at Courtney Sharea. Thank you so much for spending this time with me. I appreciate y'all so much and I hope that you found this information useful, and I'll see y'all in the next video. Peace.